This is Dr. Antolak from thegentlendentist.com in Shelby Township, Michigan. 586-247-3500 is our phone number. And what I'm doing is holding his head here is I'm going to just demonstrate a couple things with sinuses and its relationship to the top teeth. So we all have sinuses. Sinuses are used to lighten the weight of the skull. It's also used to moisten the air as we breathe in through our nose, and so it goes to our lungs in a more moistened stage. And it's also used for resonance. When we talk, we can actually project our voice better because of the hollowness of the mid-face. And so with this skull, which is a live skull, a real skull, the sinuses basically lie in this region here from the top teeth here up into the area here, and then sinuses are also in this region in here. What I'd like to do now is to talk about what's called the maxillary sinus, which involves us mostly in dentistry. The maxillary sinus, I actually cut a little hole out in this model to show patients about what it is that when extracting a tooth or when placing an implant is a relationship of the sinuses. So the sinus sits right here, and you can see the top of that sinus where it is and where the teeth are. Sometimes the teeth come very, very close to that sinus cavity, and when it does come close to the sinus cavity, there are risks with either extracting teeth to exposing the sinus, or when placing an implant, that we want to make sure that an implant is not placed into the sinus. That's a really bad idea. We use x-rays, and we use sometimes what are called CAT scans to determine the location of the sinus compared to the type of surgery we want to do. The sinus is a cavity, once again a hollow cavity. Sometimes people's sinuses can be quite infected. You know, we've heard of sinus infections all the time, or sinusitis, which is a swelling and inflammation in the sinus. Whenever we do surgery, we have to consider that. These issues that take place have to do with the lining of the sinus. And so the lining of the sinus is a very thin layer of mucosa that surrounds the entire sinus, and it contains actually cells, cilia, that are constantly trying to move away moisture and things away from the sinus and clear that sinus cavity clear. And sometimes people have allergies where these sinuses thicken up quite a bit, and we can see these on a CAT scan. But now its relationship to where the top teeth are here is if someone has sinus problems, and let's say they go flying or they walk down the steps hard and the top teeth are moving, the sinuses will feel, the sinuses and the top teeth, they're sometimes so intimately close together that they'll actually, one will feel like a toothache. If they have some sinus problems, they'll feel like a toothache. And when you fly, that changes the pressure within your sinuses, and that can also make it feel like you're having a toothache. So that's one thing to consider also about making sure you have a dentistry done when you don't have any sinus problems, because sometimes they can relate with each other. And another thing that we have to be concerned about whenever we place an implant in, we need to make sure that that implant is covered by bone, and we can do some procedures where we actually lift up that membrane and then allow bone to grow underneath that sinus. And so we come underneath here, and then we can actually put bone in there and let that bone harden up, and then it creates more, the implant itself can be surrounded by bone. For example, this is an implant here. This is a large implant, okay, you can see that. And if it was used for, let's say, for example, if it were used for this tooth here, which it would never be, but you can see how close that would come into the sinuses, and that would be a problem. So always we have to consider lots of different things, including size of implants, length of implants, when we consider doing them on the upper jaw. So anyway, these are just a couple of things I wanted to show about the sinuses, the way it relates with your teeth, the way that it relates with having possible implant surgery. And so if there's any questions, you can feel free to call our office at 586-247-3500 or visit our website at thegentlendentist.com. Thank you and have a blessed day.